and welcome back to The Wrinkle. Are you wondering about Parkinson's disease? What is it? How can you tell if somebody has it? Let's talk about Parkinson's. So Parkinson's disease is the second most common neurodegenerative disorder after Alzheimer's that happens in seniors. We're going to talk mostly about the symptoms because Parkinson's disease right now is a clinical diagnosis. So that means that we make the diagnosis based on taking the history from the family and from the person. And it also involves doing a physical examination. But we don't have a good blood test for Parkinson's disease. We don't look at the spinal fluid. We don't do any special blood tests or scans or anything like that. It's a clinical diagnosis. Now, your doctor might do some tests to rule out other things that can look a lot like Parkinson's, but to confirm the diagnosis of Parkinson's disease, it's just a careful assessment. So what are those 4 features? Number 1 is tremor. Now, the tremor or the shaking that's associated with Parkinson's is very specific. It is what we call a rest tremor. So it's a tremor that we notice when a person's limb is at rest. If a person is experiencing a very fine sort of tremor, when, for example, the classic thing would be drinking a teacup and it's very shaky, or bringing a spoon up to the mouth and there's a lot of shaking, then that is not typical of Parkinson's. The tremor in Parkinson's, as I mentioned, is at rest. So when your limb is just kind of sitting there, you might see it. And it's usually slower. It's described as a pill rolling tremor. So it's kind of like if you imagine somebody kind of rolling a pill between their hands, but of course they wouldn't have it in this position because I'm holding my hand in a posture. My hand isn't at rest. So the pill rolling tremor is the classic description of the tremor of Parkinson's. It can affect the limbs. It usually in Parkinson's disease starts in one side of the body or the other. And all tremors disappear when a person is sleeping. One of the other features is stiffness or rigidity. So rigidity is a stiffening of the limbs, and it's called lead pipe rigidity. So it's kind of like stiff, the person has increased stiffness in all the phases of their movement, but it's also called cogwheel rigidity, and that's basically the lead pipe pattern of rigidity with the tremor on top of it. So it's kind of like a cog wheel, like if you think of a gear with the cogs, it's kind of that ratcheting sensation. So your doctor will probably move your limbs around and see, they're checking for changes in that tone, we call it. They're checking for rigidity and they're checking for that cog wheel rigidity, which is classic. The rigidity can be bothersome because it can make a person stiff and make it more difficult to move. And movement can also be challenged by another of the symptoms of Parkinson's, which is slowing. The medical term for that is bradykinesia or even akinesia, but basically that is a slowing down of movement. There are different ways to see this. One is often in facial expression. So people who have Parkinson's may have less animation of the face, may seem sad or depressed, or as though the person is staring a little bit, and that's because there's slowing of facial expression movements. Slowing can also happen with walking, and that is something that is also often affected in Parkinson's early on. The changes in the walking is probably a combination of the slowing as well as the 4th feature of Parkinson's, which is postural instability. And that is being less steady on one's feet, more likely to fall. And I do this because the classic thing again in Parkinson's is that a person falls backwards or tends to kind of it's called retropulsion, to kind of go backwards. That is another thing that happens. So there's challenges with balance. So those 2 last features, the slowing and the postural instability, can make a person's walking become very different. Usually the walking becomes slow. There's usually a posture where the person is bent forward. The steps are very small. And it's described as shuffling, which really just means that a person isn't picking up their feet that high off the ground. So there's a tendency to shuffle. When a person who's walking is affected by Parkinson's turns around, the person doesn't really do a smooth pivot. They would tend to sometimes turn around in sort of a block. So it's called en bloc turning, with turning around kind of by degrees. So those are the four main features: tremor, rigidity, slowing, and changes in balance. Other things can be associated with Parkinson's, like slowing of the bowel or constipation. People may notice erectile dysfunction. There may also be changes in blood pressure, so that when a person changes position from lying to standing, there can be some lightheadedness because of a drop in blood pressure. Parkinson's disease can be associated with trouble sleeping. So a lot of people have a REM sleep disorder that will precede other Parkinson's symptoms. So those are things that can be associated with Parkinson's disease. Now, what are some things that can look like Parkinson's but aren't? Well, stroke is one thing. So if a person has a stroke in kind of the Parkinson's area of the brain or the basal ganglia, that can produce symptoms that look like Parkinson's disease. There are many medications that can cause Parkinson's symptoms. We call it Parkinsonism or extrapyramidal symptoms, but those can look a lot like Parkinson's but are not. If you are on any medications, when you go to see your doctor, tell them what you're taking, because it'll be important for your doctor to look at that list and see if there's anything on there. Some of the common medications, most of them are psychiatric ones, but some are things like metoclopramide, which people can take to help digestion. So if you're on any of those medications, your doctor would want to know about that. So that's kind of an overview of what Parkinson's disease looks like, what are the four main features of it, and the fact that it's a clinical diagnosis. Now, one of the things that we do in the office when we think someone has Parkinson's is we give the person the treatment for Parkinson's disease. That involves replacing one of the brain chemicals, dopamine. So oftentimes when we give a person a prescription for the dopamine and the person takes it, they will notice right away that symptoms are better. And that can kind of help to lend credibility to the diagnosis of Parkinson's. So your doctor might suggest a trial of medication and then have you back in a few weeks to see if it's helped. If it's going to work, it would be something that one would notice fairly quickly, definitely within hours after taking a tablet. So it's really helpful sometimes to have that trial of medication. So there you have it. That's just a quick overview on the main features of Parkinson's. I hope it's been helpful. And as usual, please add any comments or questions below. I'll see you next time on The Wrinkle. Hey, it's Dr. Divic checking in to see if you want more wrinkle. That didn't sound right. How about if you want more of the wrinkle? If you enjoyed this video, give it a thumbs up, and if you didn't like it, give it a thumbs down. I want to know what you think. There's a space below to leave comments as well. And you can always hit the little red rectangle to subscribe. That way you'll never miss a video. We upload twice a week on Tuesdays and Saturday mornings. There's lots more Wrinkle over on Facebook as well at The Wrinkle 2. You can see all of our videos there and some other posts, and that's a great place to interact with other viewers. We're on Twitter at The Wrinkle 2, and you can always send me an email at wrinklechat@gmail.com. I try to answer every single comment or question that I get. Thanks so much for joining us here today, and I'll see you again soon on The Wrinkle.